Namaste. World Cancer Day is an international day observed on the 4th of February every year to raise awareness of cancer and to increase its prevention, detection and treatment. World Cancer Day is led by the Union for International Cancer Control to support the goals of the World Cancer Declaration written in 2008. The 2022-24 campaign theme is Close the Care Gap. The theme seeks to understand and recognize the inequities in cancer care around the globe. Today we have Dr. Tinu Elizabeth, Senior Resident, Department of ENT and Head and Neck Surgery at Government Medical College, Ernakulam, to address us. It's my proud privilege to welcome Dr. Tinu Elizabeth Thomas to our midst on this special occasion. Dr. Tinu is an alumnus of our school. She is an MS in ENT and Head and Neck Surgery, and she has completed observership and training in Head and Neck Oncosurgery from Regional Cancer Center, Trivandrum. I cordially invite Dr. Tinu for this session.
Namaste to all. It's with great joy and nostalgia that I address all my dear teachers and young friends, because after so many years, I'm back to the same school assembly. Beautiful memories are just rushing through my mind right now. Today is World Cancer Day. It's a day observed to create awareness among individuals regarding this deadly disease. It's a day to make us realize our part in prevention and cure of this disease. When a cell loses its ability of controlled cell division, it leads to unwanted proliferation of cells, resulting in a tumor. A tumor could be either malignant or benign or pre-malignant. A benign tumor is a safe tumor, whereas a malignant tumor can spread to different parts of the body. It can destroy its surrounding structures. So, a malignant tumor is otherwise known as a cancer. A tumor with the potential to become malignant is known as a pre-malignant tumor. Now, what causes cancer? It could be individual factors, environmental factors, or malignancies can be sporadic. The individual factors can be one, age, because majority of the malignancies are common among older people, whereas leukemias are common among children. Second is gender, because certain malignancies like malignancy of the breast, the ovary, they are common among women, whereas malignancy of the oral cavity, malignancy of the lung, these are common among men. Then the familial tendency of genetics, especially in cases of certain malignancies like malignancy of the breast, then a type of thyroid malignancy known as medullary carcinoma thyroid, likewise malignancy of the large intestine or carcinoma colon. The environmental factors can be exposure to sunlight, because UVA and UVB rays have an important role in causing malignancies of the skin. Likewise, occupational hazards like exposure to silica, asbestos, they are carcinogens. What are the early symptoms of malignancy? Now, depending upon the site affected, the symptoms can vary. However, with the two characteristic features of malignancy is, one is unexplained weight loss and second is unexplained fatigue or cancer cachexia. So the other common symptom is vague lumps or vague swellings in different parts of the body. Especially when they are painless, we should be extra cautious. Similarly, altered bowel habits in elderly people, like mixture of constipation and loose stools. Some days of loose stools, some days of constipation. This is known as altered bowel habits. The other is blood in sputum, bleeding, like even bleeding after attaining menopause. So these are the other, the red signs of malignancy in your body. Another thing is any swelling in the breast of a man or in the breast of a male. You should be extra cautious because that has high chance of becoming a malignancy. Now, how can you prevent cancer? Is cancer preventable? My answer is, to a certain extent, yes. Because two malignancies, especially hepatocellular carcinoma or malignancy of the liver, also carcinoma cervix or malignancy of the uterine cervix, these two are vaccine preventable malignancies. You can use the hepatitis B vaccine for hepatocellular carcinoma and Gardasil or Cervarix for the cervical carcinoma prevention. The keystone, however, is screening of the family members, especially in familial malignancies like malignancy of breast, medullary carcinoma of thyroid, carcinoma colon. If any individual in your family is diagnosed with these malignancies, do not hesitate to screen the entire family for the disease. Because early you detect the disease, better is the cure rates, better is the quality of the remaining life. Then obviously, this is my personal advice and request to my young friends. Do not engage yourself in smoking, alcoholism, chronic tobacco use, pan chewing. Please, they have got a direct carcinogenic role. Now, regarding the treatment options, mainly we have surgical, then we have radiotherapy, we have chemotherapy, we have genetic therapy. So that is in the hands of the doctors or the medical panel. But the early detection, the early early identification of the symptoms, that lies in the hands of a common man. It's disheartening to see that majority of the patients, they present to us in advanced state of malignancy and not put your family members and ourselves, the doctors, in such a hopeless condition. Go for early detection. Be brave enough to go for early treatment of malignancies. So I wish all of you a very healthy and prosperous life.
Thank you, ma'am, for the informative talk. Taking inspiration from Dr. Tino's words, let us pledge to be more alert about the malady of cancer and the care gap involved. Let us confront inequities and invest our resources to achieve a just and cancer-free world. Thank you.